Good evening. Welcome to Progressive Soup. My name is David Stevenson, and tonight our guest is Merrick Alpert, Democratic Party candidate for United States Senate. Merrick, to begin with, tell us a little bit about tell our audience a little bit about yourself.
Sure. Thank you for having me here, David. It's great to be with you. I was born in Hartford, Connecticut. On day 3 or 4, my mom took me back to Colchester, and really that's where I grew up. That's where I was raised. I was raised by a single mother. My father left when I was a little boy, and I didn't see him again. And my mom was a school teacher in the Colchester public school system, a union school teacher. And she also, in order to make ends meet in light of the situation, she cut bread at the local bakery, at the Colchester Bakery. So I saw somebody from the very beginning struggle to stay off of welfare, struggle to get out of poverty, and work 2 jobs to take care of my brother and sister and myself. And through the support of the people of Connecticut, through the loans of the people of Connecticut, I was able to attend the University of Connecticut. And from there to go on to Trinity College and graduate from there, and then to Georgetown Law School. And that was the beginning. So very humble origin, I like to say.
Certainly. Tell our audience why you're running for United States Senate.
Sure. Well, I'm running because I look at my life and see the opportunities that were provided to me by the people of the state that loaned me the money to be able to go to school, by the opportunities I was afforded by going and serving in the U.S. military overseas in Bosnia as a peacekeeper, and then coming back and successfully putting together a couple of small businesses and growing those and selling those, and marrying a terrific woman and having 3 little kids. I want others in the state to have that same opportunity, and that opportunity is being lost. I think it's time for a fundamental change. I think it's time we stop re-electing career politicians and we start electing folks that come from a different background. That background for me is a private sector background. I understand how to create jobs. I've successfully done that. I understand how to grow businesses. And that to me is what we're desperately in need of in this state. My focus is on job creation first and foremost. It's on providing educational opportunity for everyone, because I know that's what got me out of poverty. And it's also about clean government. And I think until we take back the government, until the folks who allege to represent us are no longer controlled by millions of dollars of special interest money, nothing's going to change.
Let's focus on health care, if we will. The 3 most talked about choices in health care reform that we're seeing talked about are single payer, which is essentially Medicare for all,
yep.
A public option to compete with the HMOs, and what's called a co-op plan, which, as I understand it, is more supportive of the HMOs and keeps them empowered more than the other 2. Go into detail about how you see those 3 options and which one is most appealing to you.
Well, I'll give you some background first for me, David. If I look at my own life and my involvement in these matters, 15 years ago, 16 years ago, I volunteered after I had worked on the Clinton-Gore campaign and worked on the inaugural. I volunteered to go out to the state of Oklahoma and to work on President Clinton's health care initiative. I was working for the National Health Care Campaign. And at the time, we were trying to get David Boren's support in the U.S. Senate. It all came down at that time, or at least the belief was, it was going to come down to a series of moderate Democratic votes. Fast forward 15 years, 16 years, same fight. It is the same fight, and that is to figure out how do we provide health care security for all. I could tell you from my experience in Oklahoma, I learned 2 very important things from spending month after month after month looking at this and going out and hosting town hall meetings and listening to folks and sharing the Clinton plan with them. First, people want health care. They want health care reform. They understand it's necessary. They understand there are tens of millions of Americans without health care coverage. But second, and these 2 points in some ways in many people's minds conflict, people want choice. They don't want a government-run system, and they're adamant about not losing their relationship with their doctor. And those are the 2 forces that 15 or 16 years later, as we re-engage this fight, it's the same 2 forces that are at play. From my perspective, it is not realistic to think that we're going to have a single-payer system in this country at any time soon. I learned then, as I'm learning now and doing all the town hall meetings across Connecticut each week, people don't want to lose their choice. So a single-payer system is not viable for us right now. You're either going to have a form of public option, a government option, or you're going to have some kind of pooling or cooperative structure. I think that right now the push from the Democratic Party obviously is to have some form of public option. I would like to see that. The challenge is going to be whether or not the Republicans, quite frankly, can shut this thing down. Their effort is very clear, and that is to stop all progress on the health care front as far as the progressive agenda is concerned. What I'm very concerned about over the last few days, I'm seeing the same blocking movements, the same blocking strategy from the Republicans that I saw 15 or 16 years ago when I was engaged in the health care reform effort then. And my concern is if they can pour enough sand in the gears and really slow this thing down, they can cease all progress on the issue. I think that would be a terrible tragedy because, as you know, 46 million Americans today remain uninsured. And to me, that's not acceptable.